look in America, the #1 prescribed drug that we provide is oxycodone. That's our #1 prescribed drug. High patient satisfaction doesn't equate. There's actually studies that show high patient satisfaction does not equate with high quality outcomes. If you want to be a doctor and we're going to reward you on the voice of the patient and on patient satisfaction, then just keep writing the oxycodone. So how do we address that?
The long-term solution that's really going to both improve the patient experience and control costs is if we have the team approach where we can have case managers, health educators, a doctor, a nurse, pharmacist all working together to provide that engagement, that patient experience. So we can take a yoga approach to managing the pain, relaxation techniques, and not just throw Vicodin, which is going to lead to long-term problems.
We looked at the results of 6,000 focus groups over the last decade with 50,000 patients and their families, and we asked them, what are your top concerns about the healthcare system and your interactions with it? The top 2 things were, nobody listens to me. People do not listen to me about my lived experience in this body, and nobody else has been here except me. And the second thing that they talked about was the lack of caring attitudes on the part of healthcare staff, that when they're in the hospital or they're in the clinic, that the person at the front desk doesn't look up. They're doing whatever they're doing. You feel like, oh, am I invisible or am I here? Does anybody care? We don't listen to patients. We don't respect them. I saw a study that came out just recently, and it talked about the impact of the physician's relationship with the patient in bedside manner. And what they found was it was more powerful in preventing cardiac events than being on a statin or taking a low-dose aspirin. Now, until we as a society can understand the power of that relationship and begin to use it, we are missing the boat.
I think our entire health system is built around how we pay for services. And because we incentivize more and more diagnostics, more testing, we have a medical arms race that happens in communities all across the United States where hospitals are in competition with the hospital across the street. Our current payment system leads us to have an oversupply of hospital beds and overuse of services, and this will change drastically when we have payment reforms that actually point us toward care that is more patient-centered and allows, I think, for that doctor-patient relationship, because we pay for the time that it takes to develop relationships over the long term. You can't pay for the relationship. You've got to pay for the time.
All of us are living longer, and many of us will age into dementia. It's just the way it goes for many folks. And we don't have a good dementia care system in this country. We don't have adequate funding for the kinds of resources or the type of treatment that I think we would want for ourselves or our loved one. And we've not figured out how can we support people in their homes, because that's where literally 99% of us would prefer to stay, to age in place. We don't have a system that can support that at this point. So that's something that's going to be very important for us to think seriously about.
You think about how much money we spend at the end of life when the patient doesn't want it. In many cases, the family doesn't want it. And in an environment where you've got a trusted relationship in a patient-centered medical home, it is in fact often the primary care physician or nurse practitioner who can say, let's really talk about this, because is this really what you want to do? And here's the path you go down.
There have been randomized trials that compare patients with advanced cancer who get early palliative care versus the control patients who don't get early palliative care. So quality of life is obviously better with early palliative care, but guess what? The patients with early palliative care live longer. So I mean, it was a striking finding that when we focus on symptoms and on what patients are caring about, these things that we think are giving up are actually helping people live longer. And I can tell you 95% of the time the patient chooses, especially in the elderly, the less aggressive, less costly treatment. And that's exactly what your organization is trying to do, to engage patients in those decisions.